Hello, everyone, and welcome to the Feed Your Brain series. Today, we will explore the evolution of workplace mental health programs with the Mother of Safety, Maureen Shaw. My name is Paige Blaine, and I'm the event specialist here at Workplace Safety North. We appreciate your attendance here today and want to share with you that today is our third Feed Your Brain webinar in 2021. Join us next month as October is Healthy Workplace Month and WSN is offering free Wellness Wednesdays webinars to help improve workplace mental health and make Ontario workplaces a safer place to work. Before we get started, we want to mention a few housekeeping items. During the webinar, you may see the screen freeze up or hear static on the microphone. This is usually temporary and due to internet connection issues. We appreciate your understanding and patience with the technology. Your microphones have been muted, and we ask that you use the Q&A at the bottom of your screen for speaker questions. If you have any technical issues using the Zoom application, do let us know in the chat box and we'll do our best to help you. So to clarify, please put any commentary or technical questions in the chat box and speaker questions in the Q&A section. Resource information and a recording of the webinar will be sent to you within 1 business day. Now I'd like to pass things over to host Angele Poitras, Community Engagement Specialist and Certified Psychological Health and Safety Advisor at Workplace Safety North. Welcome, Angele.
Thank you so much, Paige. Always a pleasure to be here on a Feed Your Brain. For those of you who've joined us before, you know we always start with one thing. We'd like to know a little bit about you. We're not in an actual physical room with you, so we're going to do it by poll. So Paige is going to pull up a poll, and we'd like you to take a look at it. And I want you to rate your mental health of your workplace. Don't even know the words mental health, just starting, well on our way, or we're leading the way. And while you think of your answers and take a moment to fill out the poll, I'm going to explain to you who Workplace Safety North is. Many of you have probably heard about us in the news because we're very proud of our Ontario Mine Rescue Group that helped bring up 39 miners from Valley's Taunton Mine. We're so proud of them. And for those of you who haven't been following it, it's like walking up the CN Tower twice is how far these Ontario Mine Rescue volunteers had to go to get our people out safe. So we're very, very proud of them. So we're a partner in the Ontario Health and Safety System. We're located in the north, and our primary audience are the natural resource sector. So the mines, the forestry, pulp and paper, and printing and converting. But we've also been known to extend a helping hand to anybody in the north who needs our help. Our specialists do training, we do consulting, and we are proud to announce to everybody that we do have a mental health team made up of psychological health and safety advisors, one of which is me. So our guest today will come on just after we do our poll. So Paige, do we have the results from our poll? We do. So I'm going to start with the 4% who are leading the way. Accolades to each and every one of you. That's wonderful to see. Well on our way, 37%. 50% of you are just starting. And then there's 9% that don't even know the words mental health. So if you take a quick look at our poll, it just shows you the mental health journey is a journey we're all on. We're all at different places. And the one thing that we've come together today to do is learn about the evolution of mental health. So I hope you take some tips and tricks. And if you're one of the 4% that's well on your way, please use our chat box and put some information in there, or the Q&A box, sorry. So today, I'm going to welcome our guest, Maureen Shaw. Maureen Shaw retired as the president and CEO of the Industrial Accident Prevention Association, the IAPA, not IAPA, headquartered in Toronto in 2010 is when she left. Maureen's been a founding director of the Safe Communities of Canada. She's worked with a coalition of organizations in creating safer communities to live, work, and play. She assisted in taking this model to China, where Hong Kong became a leader and mentor in Asia. Maureen has served as a founding member of the Mental Health Commission of Canada's Advisory Committee on Psychological Health and Safety, and she's led the integration of mental health and wellness into workplace health and safety in our workplaces. She's spent over 35 years providing leadership in the evolution of health and safety at provincial, national, and international levels. She's a thought leader, a lecturer, presenter in boardrooms, conferences, and in the education community. She's currently a member of the advisory board of Equinox Life Care and My Workplace Health, Radiation Safety Institute of Canada, and the editorial board of OHSA magazine. She's a member of the Executive Health and Safety Council of BC, and she's also an advisor to the Manufacturers Safety Alliance of BC. She's provided strong support and guidance to the Threads of Life Association, an association for workplace strategy, family supports, and she continues to be a strong advocate. Maureen has been recognized nationally and internationally for her leadership, including one of 60 recipients of the inaugural Queen's Diamond Jubilee. She's been recognized by the ILO for her contribution and commitment to the worldwide advancement of occupational safety and health. And it goes on and on and on. The accolades could never be enough for Maureen. Now she's preserving and enjoying her lifelong love of reading, writing, visual and performance arts, and she's encouraged her children to see beyond the lines, and now she's doing it with her 3 lovely grandboys. She's vice chair of the Canadian College of Performing Arts, and this helps her fulfill her passion for performing and educating and helping talent to fulfill their dreams. She shares this wonderful life with Norm, who we were very happy to meet prior to coming on live. So Maureen, welcome. And I'm so glad the technology is working with us today. I have to share with our group, Maureen, before we start, that you were one of my mentors. I used to work with Maureen at the Industrial Accident Prevention Association, and I'd like to publicly thank you for igniting a flame in me for occupational health and safety, and more specifically, psychological health and safety. And I am thrilled to share the very essence of you, Maureen, with our viewers today. And I hope that you ignite many more mental health flames today.
Oh, Angel, thank you so very much. What an amazing introduction. I'll tell you, it really makes me feel like I'm getting really, really old, which I guess I am. But it has been a wonderful life and a wonderful experience, and I've met so many amazing people. And Angel, to see you sitting here today doing what you're doing, it's really a very satisfying thing. So thank you for having me.
It's my pleasure.
It's like old times to be sitting.
It is like old times. Maureen and I were talking about when we used to host the big international conferences in Toronto, and our feet would be sore, and we would sit on the side of a stage and talk about all the thoughts and all the energy and passion in the room. And so we're trying to replicate that with you today, even though we're online. So as always, we have 3 themes when we do a Feed Your Brain. So we're going to talk about the past, we're going to talk about the present, and we're going to talk about the future of the evolution of psychosocial safety, mental health in the workplaces, whatever title you would like to give it today. This is what we're going to explore. So we really do encourage you to use the Q&A and come up with some questions and comments, because we really do want to hear from you. And I'm going to give it over to Maureen, and I want her to share with us a little bit about the past, because she made a very interesting comment to me just before we went live. And I think the group would really like to hear about that, Maureen.
Thanks, Angel. Yeah, it's interesting. When I look at the results of the poll, and I see that we've got some people who are just starting. So and some people who are, a little bit along the way, and some that are a whole bunch along the way. And like you, I really want to congratulate those of you who are a fair bit along the way, and consider that you are a fair bit along the way, because now you have a big responsibility to help to share that knowledge and your experiences with those that are, oh my goodness. Okay, I just have to respond to that. I just see Sandra Haddad just joined us and says, hello, Sandra, my dear friend. It is wonderful to finally see you. Hopefully we can have a conversation. Sandra Haddad is obviously the chair of your board still, I believe.
Yes, she is. Yes, she is.
Former chair of the board of IAPA, and a very dear friend who went through a lot of this evolution with that we went through at IAPA that we're going to talk about with us. But I really want to go back a bit, because in order to know where we want to be, I have always believed, and you've heard me say this before, Angel, we need to know where we're coming from. It helps us to be able, because I'll bet you anything the people who think they're just starting are actually a bit farther along than what they think they are. So I'm going to take you back. I'm going to take you way, way, way back. And I'm going to take you back to the 1700s. So think about 1700s. There was a physician in Italy by the name of Bernardo Ramazzini. He was the very first person who began to talk about occupational disease and the need to promote worker well-being. And that was because of the work that they were doing. You think back to 1700, it was the chemicals that they were exposed to were making people extremely, extremely ill, and they were dying at extremely young ages. So that was the very beginning of it. And we moved along a couple of centuries or so. And the next thing we knew, we were in the industrial age. So think of the age we were in the 1700s. Now we're coming into the 20th century, and we're in the industrial age. And it was Thomas Ford who began to talk about in order to get greater productivity and more out of our workers, that we needed to be looking at the hours. That was primarily the hours that workers were working, because he came up with the right ratio, where he said really workers should have 8 hours of work, 8 hours of recreation, and 8 hours of rest. So recreation was all those things you had to do at home back in the 1900s. So we can credit Thomas Ford, and it was really about those early days in the 1900s that organizations like IAPA were created in Ontario, and there was a whole host of things that came together both internationally and here and in Ontario and in the rest of Canada that caused us to come together to create associations that could service industry. Industry itself said, we have to do something about this. We're losing too many people. It was actually Ford Motor was one of the companies that were one of the leaders in forming IAPA. And when I was, one of the things I love to do is research and look at the context of history. And they talked about in a very first IAPA conference back in 1917, they actually talked about the need to look at the workplace in a broader context. So they weren't really doing it, but there at least was some acknowledgement. And years later, we went through the wars and so on, and years later we got into the beginnings of EAP programs in the 1950s. Was very early discussion around workplace wellness and EAP programs and the role that they might be able to play in assisting employers. It was primarily for employers more than employees at that time. And the beginning the conversations about the internal responsibility system. So after the Occupational Health and Safety Act was proclaimed in Ontario in 1978, that's when we really began to think about the broader context of workplace health and safety. We were, in fact, being sort of pushed into it. We started to talk about health promotion. We started to talk about culture, and we started to talk about assisting employees to become healthier. So we had things like participation. I don't know, some of us really remember participation, and we tried to mimic the what participation was bringing us in what we were doing in workplace health and safety. I know I was at that time an advisor. It was 1986, and I was an advisor to the minister chairing a tripartite advisory board to the minister responsible in Alberta. And I kept saying, we need to really hitch our wagon to the health promotion folks, because they know how to promote in the community, but we were still siloing community, workplace, and so on. And the environment was just, just beginning to have some conversations about the external environment, and if it's saying we need to be talking about the internal environment of our workplaces. we worked really hard, and we spoke at conferences, and we talked to ministers, and we went and met with the national occupational health ministers and workers' compensation heads, and tried to get them to really be thinking about this stuff in a much broader context. Then in 1986, around that same time, there was the Ontario Charter for Health Promotion. And that's when we in IPA really began sort of taking a bit of a leadership role. It was around that time, of course, that we started, one would think that all of those things coming together would have really been a catalyst, and it was quickly. That wasn't the case because, again, the economy was taking first, had the highest priority of a lot of people. We were in and out of recessions, we're going up and down. It was really a very, very tough time. And then we got toward the end of toward the 2000 mark, and we had some interesting things happening. I've been at IPA for a few years. We were talking about how could we raise the level of awareness about the impact of work on people, that we were hiring people, but we were only treating them, only treating part of them. We were only supporting part of them. And yet when they came into our workplaces, and still do, they bring their whole self with them, and that of their home, their community that they live, work, and play in. And you can't separate all of that. You can't separate all that. It's
no, you can't.
Impossible, right?
You can try, right, Maureen? But like we talk about safety in a general sense, and I'm glad you provided the context. And one of our viewers actually mentioned, thank you for the historical kind of context. That was a very quick 200 and some years.
Yeah, it was a cold spell.
But it's very hard. And we talk now at WSN about neck up safety. So thank you for giving us like a shout out that we may be further ahead than we think we are. And there's Paige. So that means we have a comment or a question from our audience. Hi, Paige.
Hi, thanks, Angel. So we do have one question from the audience, and they say, what happens when workplaces don't care about the mental health of their workers?
Well, many things happen when people don't care about the mental health of the workers. They lose their workers. Workers are generally not able to stay with them. The impact on the rest of the organization, the employees, is really significant because if we're not taking care of our workers who are suffering from mental health issues, whether it's mental health issues that they bring with them as part of being a whole person, or because of the environment of the workplace. And the impact is significant on the sustainability of workplaces, the productivity of workplaces, the retention of good employees, the ability to hire the best that you can. And there's a whole lot more, but I'll just go there.
And Maureen, in that same vein, before we go on to talking about the present, in the past, can you recall one of those very first conversations with a CEO, and it was going to be contacted around psychological health and safety? Can you just give us a little bit of a lens on what that looked like for you and maybe what you learned from it?
Yeah. Well, I learned that I had to be somewhat assertive, and I had to really have done my homework, which we all need to do when we're presenting new ideas. And you have to be really confident about what you're talking about and what you're presenting, and have the data, as much data as you can to back you up. But I'll tell you, one of my first ones was to a board of directors that I was reporting to. And I said, I made the presentation, this is where we needed to go, that we were stagnated so far as reducing injuries amongst our member firms. And there were other things that were impacting that, and mental health was definitely one of them. Well, I mean, all the excuses come pouring out, like, how do you expect that? That's not our job. Mental health is not our job. Our job is making widgets or whatever it is that we do. And you can't expect us to take that on. We can't afford to take that on. And then one of them said, Maureen, you're from the West, eh? Right? I said, I am, yeah. And they said, so you've been smoking something funny in the Rocky Mountains? So they really, his attempt at humor, but it really spoke volumes that he thought I was the one who was suffering from some mental health issues, and maybe I was because I persevered.
Yeah, and in all things, Maureen, you've taught.
We did bring them around.
You did bring them around, yes. And I mean, I think it's important that we take a little segue here and note that Maureen is smiling and laughing, and so am I. And I think it's really, really important because sometimes when we talk about very, very serious and near to our dear hearts topics, people forget to laugh, but when we're laughing, we're engaged. And I'm laughing, Maureen, because you've got me so engaged. I've been furiously writing notes, and I agree with you. Sometimes we get stuck. We don't think we've moved fast enough, but we have, because one of the first sessions I ever delivered, an elderly gentleman stood up and said to me, in a very staunch voice, in my day, we just hiked up our big boy pants. And that was home stuff, and this is work
pull
stuff.
Yourself up by your boots.
Pull yourself together, right? So now we move into the present. And I know one of the things that you and I have been talking about is about COVID. And one of the things that you said to me, which I thought was really, really interesting, was this exodus that we're seeing now of people like my age, the boomers, who are leaving work, and the impact that you think that that's going to have on psychological health and safety. Can we explore that with our viewers?
Well, it just, this whole time that we've been going through for the last nearly 2 years, and are continuing to go through and will continue to go through for time to come. It's just been so profound on all of us. And, those of us who have got experience in leading organizations and doing things, in health and safety and in physical health as well, it's really had a strong impact on us. And I sort of was reminded of something that John Lennon said one time. He said that life is what happens when you've got other plans. Like, none of us plan to be where we are today. And I think it's really poignant, and we really need to understand that in that evolution that I talked about till today, we are now creating new stories, new learnings, new sharings. And I will not use the word pivot, I promise. This is a fork in the road for us where we are right now. And it's extremely, extremely important. And I just am thrilled to see that there's so many people that would join us and want to learn and hear how they might be able to move forward and to find some colleagues that would be willing to help to support them. So where we're at today is really a place where we have learned to be able to cope with COVID. It has placed, as we well know, you cannot pick up a newspaper, turn on the television, look at anybody's job descriptions these days, advertisements for people without seeing the words health and safety. And it's so interesting because when all of this started, can you remember a very famous CNN broadcaster trying to use the word PPE? I think he thought he was saying a nasty word that his mom would get annoyed with him about, because they had no idea. And now they're all speaking like they're experts in the field. That's really indicative of how far we've come. And we just, and I don't know if you have on Google, you put yourself in for Google alerts, every day you get tons and tons of media things from around the world around health and safety and well-being. The thing that we're not doing, I'm worried that we might not be doing well enough, is that we're paying attention to it because we have to follow the public health orders and the new regulations that are in place. Some of them will be permanent, some of them will not be. And I I'm praying that that doesn't mean that we're looking for the day where we're saying, whew, glad that's gone. Because that is a bit of human nature that we want to do that. I suspect, and I think that more and more employers are seeing, and I can tell you from the Executive Health and Safety Council I'm involved in, from the leadership, CEO leadership group in Ontario that I still also follow, the leadership forum, executive leadership forum in New Zealand. They're all talking about this as a transformative change, and something that they need to be, leaders need to personally take to heart, that it has to be a personal transformation in the new way that we need to be looking at workplaces. And so, years ago, I used to talk about, and I still do, about needing to look after and pay attention to the whole person when we bring people into our workplace. We don't just hire their skills and their brawn, that we hire the whole person. Today, we need to be talking about the whole workplace. And that is absolutely core. And as we move on, using words like culture takes on a whole new meaning in what we're talking about, and how we create healthy places for people, and the kind of support that people need in their workplaces with what they bring.
Right. You talked about, interestingly enough, we're all we have an opportunity right now to choose what fork of the road that we're going to take, right? Yeah. And if you had a piece of advice for a leadership team, a board of directors who was looking to take the right fork in the road, what would you suggest that they do? What would be one piece of advice that you would say to them is absolutely critical at this point?
So I think one of the most critical things is, as we're trying to adapt to this new world order of COVID, which is going to be with us for some time, for probably forever. We're probably going to be doing booster shots like we do flu shots. So we're going to have to be ensuring our workplaces are physically healthy, safe places for people to be. And as people are coming back, we know that many people are not wanting to come back full time. Particularly, we're looking at the millenniums and the Gen Zers. These folks are saying, we don't want to come back to a workplace that looks like an organizational chart, where you've got a head and all these little boxes. And it's interesting that there's a guy who is a futurist in Alberta by the name of Ruben Nelson. He created this chart of, the grid. This is what our schools look like. We've got the teacher at the top and the rows of desks. This is what our cities are made up like. They're all, on a grid pattern. This is where our organizations are structured. And clearly there is no place for this in the future. So the big thing for employers is flexibility. You've got to be flexible. You've got to be genuine about your caring. People can see right through it if you're not. That you've got to be addressing the structural and transformative change in your organizations. You've got to be embedding right within right within the plan, right within the structure. You've got to be embedding health and particularly mental health, because that's the biggest thing. It's not, mental health is growing, illness is growing amongst people hugely. All the data is telling us that it's not getting any better, and so people are going to be demanding this, and employers who are wanting to retain, attract, and be well productive producing organizations are going to have to ensure that they embed within the framework of their organizations mental health and health and safety in general.
One of the questions that we hear bantered around quite a bit, and your expertise could probably shed light on it. What does a psychologically safe workplace look like? Is there somewhere we can go flips a chart? Is it a feeling? What's your thoughts on that, Maureen?
See, it's really interesting. Sometimes less is more better. Seriously.
Yeah.
Right? So
Yep.
you teach people that they've got to have all these plans in place. And so it's no longer boxes of paper, so not just files and files and files on that computer that people can go in and out, go look at this policy, look at this, look at this. Sometimes less is better. You ever walk into a workplace, or if I walk into a workplace, I can tell immediately that this is a healthy place for people. You can literally feel it. You can see it in the way people are interacting with each other and having conversations. And there may be some laughter. You don't get that when you're in a toxic work environment. So a healthy place is a place where people feel comfortable, where they can have where there's good relationships from the top down. When I was the CEO, one of the things I enjoyed most was going out and sitting with delivery, whether it's sitting on the stage with Angel at a big conference, and just how you doing? How are we doing? I don't know about you, but my Peter's over, right? It's having being willing to have those conversations, and not being a leader that thinks you need to know everything. Because when I hear people introduce me as being an expert, I sort of get really, really nervous about it. Because I was, blessed to have an incredibly talented team of people. When I think of people like Joan Burton and Andrew Harkness and what they did, their legacies still live on and on, and things like the World Health Organization's Healthy Workplace Model. So you can feel it, you can taste it, and it isn't about having the best charts and the best. Yes, we can measure those things. We can look at our whole health promotion programs. We can look, from the physical data. We can look at data that tells us, use of our EAP programs and drug programs, and so on and so on and so on. You can find that. You can look at absentee levels. That's a really good measure. If I see huge absentee levels, I'm immediately thinking of something that we need to be paying attention to.
I'm so glad you shared that, because I agree with you 190% that sometimes it isn't the binders that are on the walls. It's that feeling the minute you open the door. And there have been workplaces that I've gone into where the hair on the back of my neck stood up, and you couldn't pay me to spend any time there. And there was other workplaces that I went into that I wanted to become part of their staff, because they were just so vibrant and there was a real sense of caring. And a lot of that I learned from you, but there's somebody else who's on the call today, and I've got to give a shout out to her, because she has been instrumental in the Workplace Safety North's kind of choosing the fork in the road to look at psychological health and safety. And that's Candace Ballinger-Michaud, who is the former CEO of Workplace Safety North. So I wanted to give a shout out to Candace, because she certainly took the right fork in the road. I don't know if she's happy she hired me, but I am. And so it's because of leadership and visionaries like yourself, Candace, Sandra, Haddad on the line, that organizations have been able to do what they can do. And I think sharing that with other workplaces is vital right now, because everyone has that opportunity to choose what fork in the road we're going to take. And I think, in years from now, when there's another group doing a discussion about the evolution of workplace psychological health and safety, they're going to look at COVID as being one of those huge moments where some of them made the right choices and others didn't. So what do you think are going to be some of the stumbling blocks? That, say I work at ABC, I'm the CEO, and I've made a real commitment to psychological health and safety through COVID. And I've seen, some of my team members, my leadership team struggling, but I'm committed. but I know there's going to be stumbling blocks. What are some of the ones that you could shed some light on so that I could possibly not stumble so badly?
Well, I mean, as you know, one of the things we've been working on for years, Angel, and everybody, and a lot of you are still doing this, is to reduce the stigma around mental health issues in our workplaces and in our communities. We've worked really, really hard to do that, but there's still a lot of it there. And when you've got a leadership team that has not had the exposure, has not had the training, where the conversations haven't been fluid about this, you're going to find people are going to be really tight because they don't have the skills, they don't have the knowledge, they don't have the experience. So one of the first things that we need to do is to bring them together. I would bring my team together, and we would have conversations about what their fears are, and maybe the finance guy saying, we can't afford to do this. We can't afford to be hiring consultants to come in and help us with it. And it's up to you as a leader to ensure that this is a priority. This is core to your values and the ethics of the organization. We're all going to be measured on this, I can tell you, when your performance review time comes along. And if you are not comfortable with the direction we're going in, then there's other decisions that you need to be made. And I would say that I did have some of that. I have had some of that. And when we had to make those decisions, whether it was the individuals that made it themselves or I made it for them, we would have that conversation about it not being right. And I really want to say to people that when you have to make those decisions, you have to do it with genuine respect and caring. And I'm sorry, I need to keep my eyes off the bottom of the screen. It is not an easy thing to do, but as the CEO, you are the one that is accountable for ensuring that the whole organization lives the vision, lives the values, and follows the ethics. And there's many ways you can bring people together and have team building stuff and all that kind of thing. The biggest thing is to have those conversations. And one of the other things I would say, and I said it before, but in this context it's perhaps a bit different, is don't overprescribe. Like, don't say we have to accomplish all of this, the big world in a very tight. We're on a progressive journey. We want people to be able to be brought along and to grow and to learn as we're going through all of this. But there isn't an end to it. It's just a continuation.
Very wise advice. Thank you. And there's Paige. So we must have something from our audience. Hi, Paige.
Hi, we have two separate questions here. So first one, we have, our organization takes worksite health and safety very seriously, and it is very effective. I don't believe the policy encompasses mental health. How do organizations introduce mental health safety to both their job sites and also to include office staff? Well,
here's one of the things I would really suggest, and we've got Healthy Workplace Month coming up right shortly. I would really, in fact, Angel, you might want to do this. I would be wanting to have people engage a broader model than just mental health, because again, we're siloing things if we're just talking about mental health. So we're talking, I keep pushing it, the whole workplace. So I would be looking at something like the Healthy Workplace model, whether you look at the model, the World Health Organization model. I'll just hold it up here. So I should have made a slide, but I had some computer issues yesterday. So we're lucky to be here. So here's the Healthy Workplace model. As well, particularly for larger medium to larger organizations, you might want to be looking at the Healthy Workplace model has been developed by Excellence Canada, which used to be the National Quality Institute. And we at IAPA were instrumental in helping them to develop that model. And even organizations like the Mental Health Commission of Canada have embraced that model. And the reason I'm saying that is because you're looking at the workplace in its entire context. So you're not you're not leaving physical health protection because you sure don't want to do that because that's your core. But you're now looking at the psychosocial aspects of your workplace and people, and then the community, and it all centers around the workers and the leadership. So the very first thing to do is to have that conversation between the leadership team and your workplace, whether it's your joint health and safety committee, I hope you all have one, or your health and safety representative. But bring in the employees like right now, and let's have this conversation about how we bring it together. And if you're looking at, a structured way of doing it, we did it at IAPA. We introduced a healthy workplace model that we had taken the Health Canada model through Joan Burton and here we go, Andrew Harkness again. We had a team that worked on developing that model for our own usage. And over a 10-year period, we just saw an awesome change in all of the indicators of what would be a healthy place for people to be working.
Thank you for that, Maureen. And Paige, I believe you have a second question from our audience.
Yes. So how can a company or organization demonstrate a psychologically safe workplace when it comes to their COVID vaccination policies? And just blending another one here, also any suggestions on how to care for employees who are struggling with fears about vaccines and other COVID protocols?
Well, the struggling with vaccines is something that many organizations, in fact, most organizations have had some experience with that. It's not an easy thing, but it all comes down to education. And, this is where sometimes I hate to really sound tough, but with all my smiles, I can be tough when I need to be tough. And this is a very difficult time for employers and for employees, because think about it. If you've got one employee who is not vaccinated and is not wanting to be vaccinated because of beliefs that they have around the value, the safety, the whatever of that vaccine, that's going to have an impact on everybody else in the organization. So you do the best that you can to educate, but and to encourage, but you're going to have to make some decisions. That person is going to have to come to work, and they're going to have to, if they're working on site, they're going to have to be wearing a mask all the time. There will be no taking the mask off. If they're able to do their job from home, then you're going to provide them with the opportunity to work from home. But if they're not vaccinated and everybody else is double vaccinated, and you're doing face-to-face events, like say you're having a team building exercise or a celebration of a major milestone in the organization, they won't be able to come because everybody that comes is going to have to be fully vaccinated. That will be the policy of the organization. And there's no good legal data around this at this particular time. There's no good data so far as the Human Rights Commission and Tribunal data at this particular time. There's a huge amount of debate about whether employers can in fact change the employment agreement to say you must be vaccinated if you're going to work here. I think the first things are, if they can do the job from home effectively, you try to accommodate the best that you can, you educate. But remember that you as an employer have the responsibility to do no harm in your organization. And by having somebody unvaccinated in your organization, you could potentially be creating a hazard for others. So it's about risk assessment, hazard identification. You've all been there. It applies to this as well.
And there's so many. No, it isn't easy. And one of the things that we've learned from our mental health training and working with clients is this: be kind, be respectful of all people. It's a great opportunity to practice some of what we're learning in the realm of, psychological health and safety and mental health in our workplaces. Like you say, there is no easy answer. And again, it's going to be an exploratory time for our organizations as we work through coming back. So now we're going to jump into the future. And you've got a crystal ball. And you're going to design a future that has a psychologically health and safe place. It's an organization. And I want you to describe what that leader looks like. The leader of the future of a psychologically health and safe workplace.
So the leader, the leader of the future is probably going to be some of you. I look at Alicia and Meg and Paige and some of the others that are on the screen. And these are our leaders of the future. Okay. It's up to people like me and others that I know that are on the call to be mentoring these future leaders, because the workplace of the future is going to be a very, very different place than what we see. We've talked a little bit about organizational structure and how that old grid pattern is no more, that we need to have workplaces that are flexible. It means we need to have leaders that are very, very different. One of my dreams would be that in every university that is teaching leadership and MBA programs, and get away from some of those charts and talk about people, because that's the organization of the future. We've been through the industrial era, we've been through the information era, and now we're into the human era. So it's all about doing it. And if the leader of the future hasn't got those skills, they're not going to last very long, because we've got a generation coming into our workplaces in middle management and leadership roles who simply are not going to put up with any garbage, and they can tell whether you're being genuine or not. So being genuine is absolutely key. Empathy has always been a key ingredient to good leadership. Having been able to go through a personal transformation. I mean, I think we've all met leaders that has happened to, and unfortunately at this point, many of them have gone through a personal transformation because of a personal issue. For example, one of our BC Safety Charter members had an employee during COVID died by suicide, and it struck him so incredibly that it literally transformed him. And he said, "Now I see everything you've been trying to tell us, Maureen. You're absolutely right." And he's now lecturing to fellow CEOs. It's a time when we're going to have leaders are going to have to. They'll be putting organizational culture first. So they're going to be using the culture of their organizations that they're created in order to attract people, because that's where people are going to want to go. So clearly, the leader of the future is going to be someone who is genuine, who really cares about people, who understands the impact on their business, and that putting people first, that old adage that I've been using for many, many, many years, actually is true. It's because they will not be able to be organizations that will be productive and successful if they don't do it.
So in all these attributes for our leaders in the future for psychologically safe workplaces, would you think that one of those attributes would be the ability to be raw and open?
Oh, of course. I mean, that of course. To be able to cry with them if you need to. I mean, honestly, Angel, I've done it. You've seen me do it.
Yeah, I have. And I've
Um,
seen other leaders
and
do it. And that it's very,
exactly,
very difficult, right?
it's
As a
extremely,
leader to be able to do
you
that.
feel,
But yet it
yeah,
is so vitally important to an organization who's looking to be psychologically safe. Everyone has to feel the same level of safety, from the CEO to the board, to the clients, to the people who work there. And I think it's important that you brought some of those attributes forth. We used to work with a gentleman named Brett Webb, and he always said, we called him the doctor of happiness. And he always said that we should be teaching the soft skills, which he really thinks are hard skills, to our children in school, more so than math and reading. He said, because it is a really barometer of how successful you'll be as a person. But if you do strive to be in a leadership position, those who've excelled in these soft skills seem to have a different culture when you walk into those workplaces. And, you know, I want to take a shout out to my current CEO, Paul, because he certainly chosen every right fork in the road for that. And he's a very open and transparent leader. And that makes a huge difference when you're trying to design an organization that feels psychologically safe.
yeah.
And I think that's so important. And I mention it because he's a valuable resource to anybody who's on this call. He may not know it, but we're going to send out his email address, and feel free to get in touch with Paul because he's had his own journeys and he's very interesting to talk to. And I think that's why I'm able to have these kind of conversations, because I work at an organization that fully supports it. And like you said, Maureen, we're all on the journey. And it's just how we're choosing to move forward with the journey. And as our time is going to come to a close really soon,
oh my goodness.
We always end our Feed Your Brains with our guests. And so before I hand it over to you to end it, I want to thank Paige and Meg and Alicia for being in the background for this call. Always important to have you with us. I want to thank each and every one of the 86 guests that joined us today to share a conversation with Maureen. I hope we were able to give you a sense of what a real conversation used to look like in the old days. And I saw some of the banter that went on, so I'm hoping we were successful. I want to let you know that Paige will be sending you a video, a recording of this and some slides. And I'm also going to suggest that we send out the healthy workplace model from the World Health Organization, Maureen. And I want to thank everyone for joining us today. And so, Maureen, you've been called the Mother of Safety. You've guided IAPA and other organizations, and now you continue to mentor. So this is your moment. You have an opportunity to share with our viewers one piece of advice, one story, one experience that you would like them to remember. And thank you for being my guest today.
Oh, Angel, it is an absolute honor and it's just been a thrill to be able to connect with you again, and so many of the people that you have mentioned. I just wish I was in the room and could give you all a great big hug, because one of the things we need when we're going through trying to help organizations change them to be bringing up issues and topics that are not people are not necessarily comfortable with, mostly because they don't have the knowledge, and when you don't have the knowledge, it's really a very uncomfortable place to be. I would just like to say that all of the years that I've been working, I have always tried really hard to really show people that I care about them. I've never had sort of instant solutions to problems. I still don't have what I would consider absolute solutions to problems that we all face in our workplaces. But it's really important that we're able to have conversations together. And if you're in a workplace, any of you online, if you're in a workplace where you know this is the direction you need to be going in, and you're having difficulty, you don't know where to start and you don't know what to do, the very first thing you need to do is to sit down and engage, really say to to your bosses, to the leaders of your organization, that we really need to have this conversation. It's not about you, it's about the organization. And look what, if we want to be competitive, if we want, use the business terms as the hook if you need to get there. I would just say, and to all the young women that are on, I'm now in my late 70s. I've been doing this work since the early 80s. And it's been a journey. It's been a journey that I have experienced being the first woman to do a whole bunch of things. And that's not, I don't want any credit for that. I'm saying it because it's been part of that evolution. I know what it feels like to be harassed, to be bullied, to be treated as something, a woman, less, what can I possibly know about this? To have guys at the end of a meeting pull out the bottle of scotch and put it straight in the center of the table, and boom, now you're no longer part of the conversation, or to exclude you from the conversation by talking issues that you really know you don't have any interest in. And so we have evolved and we've grown, and now we have workplaces where many of the young women are in fact taking on the leadership role, particularly in the areas of mental health and well-being. And I really want to support you, and I think we all want to support you in that. The other thing that I think is probably a concern that nobody talks about is what is the role of the health and safety practitioner. It's really difficult because health and safety practitioners are not trained in the areas of mental health and health promotion, but they're going to have to in order to face that workplace of the future that we're talking about and that we were talking about. They're going to have to be able to have those conversations and to have some knowledge. So the health and safety practitioner of the future is going to have to evolve in order to be able to meet the needs of those workplaces. And then that next phase of ensuring that our universities and our schools of business are really training leaders for the future, which right now they're not. So that's, in my view, they're not. I don't know of a program that talks about the human condition in our workplaces as something that leaders need to be paying attention to. They're now learning it through some of them. Just because something significant happens, they learn about it, or they've been smart enough to get involved with a group like the CEO Charter Group in Ontario and in Saskatchewan, in British Columbia. So there's a lot of work to do, and you're going to need a lot of support. All of us are going to need a lot of support. So it's time for people like me and others to ensure that we are mentoring these people of the future and using our experiences to help to evolve the areas that I've talked about that needs to be evolved, and to stay connected with each other. I'm more than happy to talk to people and connect you. I mean, one of the things I enjoy doing is connecting people, and I have been mentoring a young woman who's an incredible leader here in British Columbia. And we're at the point now I've said to her, you don't need me anymore. You're flying. And so I can go on to something else or even take a bit of a rest. And so, Angel, thank you. I hope that helps a little. I care about you all. And yeah, see, I'm getting a little teary because it's been really lovely to reconnect with you.
Maureen, as always, 49 minutes, 52 minutes is definitely not enough. I've again learned a million things from you in a very short period of time. So I thank you. I send you a virtual hug. I wish it could be real. And for all of those that of you are on the line, please join Workplace Safety North next month for Healthy Workplace Month. We have a wonderful, wonderful roster of free sessions for you. It's our gift to you during Healthy Workplace Month. So join us. I don't think you'll be disappointed. And Maureen, I leave the viewers with your words of wisdom. When you're going to go make a business case for psychological health and safety in your workplace, do your homework, know the data, be passionate, and be assertive and smile while you do it. So thank you very much. It's been wonderful. Bye-bye.
Take care.
You too. Bye.
Bye.